I thought, I draw this crazy little outdoor scene, and she tells me about my whole life. Now, on a mystical level, I'm out giving a lecture, and I could sense that what I was saying was not what I had planned. I mean, I had a whole, when I first started the lecture, I'd have a whole outline, what you're going to say. Now, it's like that comment, let George do it. Yeah, it's my unconscious. I don't care. I just get up and talk. I mean, I bring lots of papers in case somebody's written me a letter or a poem, that I may not have in my memory. But I'm speaking, and I realize what you're saying is better than your plan. So just go ahead. When I'm done, the first woman comes up to me from the audience and says, I've heard you before, that was better than usual. The second woman said, standing in front of you for the entire lecture was a man. So I drew his picture for you. And it's George. I mean, this is a guy with a beard. Yeah. And a few years after that, I was speaking at a friend's funeral service. And when I came out, I'm standing in an empty hallway. And Al Gawaro, who was a healer, who also knew him and was there, came up to me and said, Bernie, you Jewish? I said, why are you asking? Because I give a sermon on Sunday at a funeral? She said, no, it has nothing to do with that. But there are two rabbis standing next to you in the hallway. Her description, there's George. Yeah. And later, when I look back, even the hat he wore was what prayer caps were like maybe 100 or 150 years ago. Yeah, not the little flat
not
piece.
The yarmulkes now.
Yeah. So it was just incredible because her description is exactly the robe he wore, everything from his foot to the top of his head, she told me, and that's exactly. So, I can accept that. And I've heard voices that have made incredible changes in my life. One that helped enormously when my father was dying, I went out running. Because that's like a meditation for me, to be by myself. And a voice said to me, how did your parents meet? And when I say a voice said to me, I just hear it. And I said, I don't know. And the voice said, okay, ask your mother when you get to the hospital. So when I get there, again, I walk into a room where my father and mother are sitting and he's dying, and I don't give a hug, I walked in, and because the voice also uses me, and said, how did you two meet? And to make a long story short, the end of my mother's first story was, your father lost a coin toss and had to take me out. Because she was sitting with girls she didn't know on a beach on vacation. She said they had a terrible reputation. I didn't know that. But your father lost a coin toss and he had to take me. And my father died laughing because of that statement, see? Because she went on to tell other stories. I don't know why they stayed together. When you listen, she fell out of a boat. All kinds of things happened. My father died looking wonderful. He was in coma, see? But you know damn well he's hearing. When you see his cheeks get pink and a smile appear, I thought he was going to open his eyes and say, I'm not dying today, this is fun.
Yeah.
But when see again, how could he know who's coming? Got grandchildren, great-grandchildren all over the country. But when the one who said, I'm coming, the last one, entered the room and was announced, he left the next minute. So I've learned we have that ability too. I'm not going to get into all the death and dying stories, but I've realized that we can turn the switch on when we want to survive, but when our body no longer pleases us, we turn the switch off, and we don't have trouble dying. And one of the things that I think it's important for us to realize, this is a poem by John Updike. The scab is a beautiful thing, a coin the body has minted with an invisible motto, our body loves us. Say, in God we trust, our body loves us. That's in one of my books. When I first read it, I was more interested in the scab, in the sense of, I can operate, you'll heal. But then, as I reread it, our body loves us. That really hit me, because what I realized is, your body is interpreting your messages. So if you love your life, well, let's quote Solzhenitsyn in Cancer Ward. One of the men says, look, I found this book in the medical library. It says here there are cases of self-induced healing, not recovery through treatment. Can you stop that for a minute?
Sure.
All right, because he's going to be a pain in the neck. But Murphy, stop it. Okay? Get upstairs. Go on. Go. Get up. Stop it. I'm busy.
It's going, but I want attention too.
I know, he's a spoiled kid. I mean, in the car, everywhere. He never stops for a minute. Now, where was I? Oh, yes.
Wait a minute.
Right.
Go for it.
In Solzhenitsyn's book, Cancer Ward, and he also had cancer, one of the men says, look, I found this book in the medical library. It says here there are cases of self-induced healing, not recovery through treatment. When I saw that statement, I thought, wow. So he intuitively knows something. He didn't say there are cases of spontaneous remission, so there were miracles. Self-induced healing. Flooded out of the great open book like a rainbow-colored butterfly, and they all held up their cheeks for its healing touch as it flew past. And then again, a rainbow-colored butterfly. Get your life in order. See, to me, it was no coincidence that I didn't have a butterfly, but I had this bird who used to sit on my shoulder named Rainbow. Yeah. And the butterfly is a symbol of transformation. And I realized, again, yes, you help people get their life in order, you know, again, born again, create this new authentic life. The body gets a message. You love life. Okay, I'm going to do every damn thing I can. Bacteria and viruses alter their genes, so do plants, and to survive. We're capable of that too, but it's a lot more complicated. I always say, our lives, you know, if we got credit cards, marriages, you know, kids, jobs, yeah, the bacteria don't worry about those things. So, oh, antibiotic, I'll fix this, and I'll use it for food. And I think that's the key. But you see, the body is interpreting what you're telling it. So you wake up on Monday morning, this damn job, this lousy traffic, that your body says, I'll do you a favor. So Monday morning, heart attack, stroke, suicides, illnesses, yeah. Your body thinks it's doing you a favor. You don't want to go to work? Fine, well, go to the hospital, or you'll be dead. And I mean it. And death, I know. And I say I know because I've left my body almost choking to death as a 4-year-old. When you leave your body, you're perfect again. So I don't have any fear or problems with death. But if I like being here, I've got to let my body know that I love my life and I love my body, so it will keep doing the best it can for me. You know, when I started asking people, what's happened the last year or two in your life? How do you benefit from an illness? Oh, you're blaming your patients. Wonderful poem by W.H. Auden. Doctor comes home after examining Miss G. Says to his wife, who's a lonely lady, no family, no children. He says, you know, cancer's a funny thing. Childless women get it, and men when they retire. It's as if there had to be an outlet for their foiled creative fire. When I read that, see, but an oncologist yelled at me, just because it rhymes doesn't make it true. But, you know, would a poet write that if he didn't see it in the world? No. So when I would read something like that, yeah, and that's why I would say to people, well, see, in the 30s, Alida Evans wrote a book on cancer. Cancer is growth gone wrong, a message to take a new road in your life. You see, that's before we had all these treatments and things, so you focused on the person and their life and what was going on. And the sad part was when I thought I was discovering things. See, I went back to the hospital with a box of crayons after what happened with Elizabeth, and I thought, wow. Then I began to literally make diagnoses from drawings. Okay? People will show you what's going on in the body. So will dreams. I have never met a doctor who's been told that about 90 years ago, Carl Jung interpreted a dream and made a correct diagnosis of a brain tumor. I mean, the underlying theme was there's a milky pond that is obstructed. And he came up with mammary bodies, which is something at the base of the brain, and cerebrospinal fluid is blocked. So he ultimately said it's a brain tumor and blocking the flow of cerebrospinal fluid, and he was correct. And he doesn't know the man. All he knows is a dream that's told to him. And I read that, I thought, wow. So yes, I talk to people about dreams. I say, do a drawing. I have operated on people and not operated on people because of the drawing they do. I mean, just so people understand the simple way. Somebody comes in the emergency room with severe abdominal pain, but draws their abdomen as green. That's a healthy, natural color. I said, we'll watch them. And They're all yelling at me, take him up the operating room. No, we're waiting. It turned out this boy later told me he was a drug addict and he was having a reaction to drugs. Again, it saved him a lot of trouble, see, because I got him to draw a picture. Now, would patients think I'm nuts? Sure, but,
Yeah.
you know. The other is the guilt, shame, and blame, though. See, draw a picture. I'm not an artist. See, so it also related to who was really into survival behavior. See, if you're worried about, do I know how to draw a picture? That's not the problem. We're trying to cure your disease, AIDS, cancer, multiple sclerosis, whatever it is. You know, let's work at that. But I realize if you brought up with guilt, shame, and blame, again, the parents, the teachers, the clergy, yeah. And, you know, God is giving me cancer, so I'm not supposed to get better. See, it's a punishment. I won't get into some specific clergy, but, you know, when we start blaming patients, I don't blame them. Recent studies did show that loneliness affects the genes that control immune function, see? Or cancer patients who laugh live longer. So suddenly, things that were crazy become scientific and research is done. Like years ago, I brought music in the operating room and was called an explosion hazard because of the gases that were there, and you're bringing a tape recorder in. Well, a few years ago, a study at Yale showed if you played music in the operating room, guess what? You used less anesthetic agents, less pain when patients woke up, procedure went faster, yeah. So, as I say, people began to mimic me, not because of any lecture I gave, but because they saw, oh, that works, let's do it, yeah. And they stopped worrying about an explosion because they felt better listening to the music, yeah. And the other was, once patients knew that there was a crazy doctor around, they would wake up when other doctors had operated on them and say, I didn't hear the end of the joke. And the doctor would say, what are you talking about? Well, you told the joke in the operating room while you were operating, and I heard the beginning, but I missed the end. See, then they'd come out saying, hey, Siegel, let me tell you something. They became believers because their patients felt safe telling them things. And it spread around. And yes, minds are more open now than they were 30 years ago, but it's still a struggle because of, again, what I call medical information, not a medical education. You're not taught how to take care of people.